How do you place an IV needle? This is a step-by-step guide for healthcare professionals.
Welcome to Human Body Tour. Today you will learn how to place an IV correctly and safely. This is an essential skill for healthcare providers in hospitals, clinics, and other medical settings. Let's get started.
Please note, this video is for educational purposes only. Always consult a professional if in doubt.
To get started, we need the following materials: gloves, disinfectant, infusion needle, tourniquet, infusion bag, tube set, and tape.
Start by gathering all the necessary materials. Check that everything is sterile and within the expiration date. Wash your hands thoroughly and put on gloves.
That is right. Always check the infusion fluid for clarity and expiration date. Choose a suitable vein, preferably in the forearm or back of the hand. Use a tourniquet to make the vein clearly visible and palpable. Make sure the patient is sitting or lying comfortably. Ask the patient to open and close the hand to improve blood flow. Clean the skin thoroughly with a disinfectant and let it dry to prevent infections. Holding the skin taut, insert the needle into the vein at a 15 to 30 degree angle. As soon as you see blood in the needle, advance the catheter further into the vein and carefully remove the needle.
Tip: use a calm and steady hand to minimize mistakes.
Secure the catheter with tape and connect the fur line. Check that the fluid flows freely and has no blockages.
Watch for signs of infiltration or swelling around the infusion site.
Remove the tourniquet and ensure the patient is comfortable. Record the infusion site and time in the patient file.
Thanks for watching. Hopefully you have learned something about inserting an IV. Don't forget to like, share this video, and subscribe to Human Body Tour for more educational videos.